Thank you. We introduced Anil earlier on the day, Lynn did, so I'd be interested to hear your take on what things are like on this side of the pond from that side, or vice versa, Anil. So thank you for joining us and bringing your perspective.
Okay. So thank you very much for inviting me here to speak. It's great to have the opportunity to meet you all because I'm new to Canada, so it's great to meet folks outside of New Brunswick as well. So I've been asked to talk about the UK-EU approach to vibration and exposure control, and we've heard quite a bit about the UK at the moment, EU and the UK in previous talks. I think also one of the things that's come out of some of the talks and some of the discussion that we've just had is the importance of leadership. And you can see here some leaders being engaged in vibration experience there. It's actually the opening of the New York Stock Exchange in 1957, I think, when they were demolishing the old stock exchange. That guy there on the end looks as though he's having quite a lot of fun, though, doesn't he? So in the EU, there's a survey, the Eurofound survey that's conducted, and it looks at workplace risks and exposures. And this graph here is showing some of those workplace risks. And you can see at the top those people who reported that they were exposed to vibration for a quarter of the time that they're at work or more. And you can see it's around between 20% and 35%, depending on which year you take. And encouragingly, it was going down in the more recent survey, the 2010 survey. You can see their leading one there of repetitive hand arm movements. So press the wrong button there. There we go. Down the bottom there. Noise and vibration, of course, similar, and they often go hand in hand. Where you've got one exposure, you've often, certainly where you've got vibration, you've often got noise. This is it by gender. It's quite interesting. So if you're dealing with people who are exposed to vibration, in particular hand-transmitted vibration, you tend to be dealing with male workforce. And that's largely true for all of those exposures, except when you look down the bottom there. And you've got infectious materials and lifting or moving people. And of course that tends to relate to care services, healthcare, where it tends to be a predominantly female workforce. This is a list. These are the musculoskeletal disorders that are listed in the International Labour Organization's list of occupational diseases. If you didn't know there was one, I'd encourage you to look at it. It was issued in 2010, it was re-updated, and I'm currently on a working group looking at the diagnostic and exposure criteria for all the diseases on that ILO list, and that's probably going to be issued within the next year, that criteria. I'd highlight to you those two in particular in the context of this talk, in that there is an item there, 1.2.2, which is diseases caused by vibration. So these are internationally recognized conditions associated with work. And so I would suggest if they're not on your provincial list of occupational diseases, they ought to be. And the other one there is carpal tunnel syndrome. And I've highlighted it here because, as Ron's already mentioned, there's good evidence that there's a more than doubling of the risk of carpal tunnel syndrome in people who are exposed to hand-transmitted vibration. So as we've already heard, the EU put out a directive. This was in 2002 now. It was on the minimum health and safety requirements for workers, and it was to do with physical agents. There was a physical agents directive. One specific part of that directive was to do with vibration. And the authority for the regulation is the EU treaty, and it can make directives and the minimum requirements for encouraging improvements, especially in health and safety of workers. But note that there's also that consideration that the directives are to avoid imposing administrative, financial and legal constraints which would hold back the creation and development of small and medium-sized undertakings. So there's a balance there to be struck, is what it's saying. But the aims of the directive are, as a first step, it's necessary, they're saying, to introduce measures to protect workers from vibration, because they recognise here that it can cause the musculoskeletal and bone problems that Ron had talked about, as well as the neurological and vascular disorders. And, gone one foot, that these measures are intended not only to ensure the health and safety of the workers on an individual basis, but that there are minimum basis for protection of all community workers. And then note that last bit, in order to avoid distortions of competition. So there's another balance there as well. This is about the fact that we are in the EU, it's not one country, a bit like Canada, and, that there's all these member states, and there wants to be an avoidance of competition between the states. You know, if France were to be more lax in the application of the directives than, say, Germany, it would potentially create a trade imbalance. It might be preferential to do business in the one country than another of the member states, and so that's another consideration that there is. And so when these EU directives are made, how they come about is through draft legislation being put through the EU Parliament with input from all the member states, and then there's discussion around policy and technical matters, and representatives of each state go and they discuss and come up with draft guidance, and then that's voted on by the EU Parliament. And then once that's approved as a directive, there has to be implementation of the directive under individual legislation in the member states. So each country then comes up with its own legislation to implement the directive. And all that discussion that goes on, there's a lot of horse trading goes on between the political representatives, making these balances between the economic costs and the societal benefits that there are from, particularly in these health and safety cases. Now, we already had a directive. There was a 1989 directive, and this was to the management of health and safety at work regulations. And this introduced a whole package of legislation, and these management regulations were a sort of overarching enabling policy, if you like, that had within them all of these requirements. So we already had legislation that fitted the bill, that meant that if you read these in any detail, you would see that it would encompass the requirements to assess the risks from vibration and to make any adaptations, technical ones. So if there's technical progress that you can do something like use a backhoe shovel remotely, then you should do it, because it says you should adapt to technical progress. And replacing the dangerous by the non-dangerous or less dangerous, having a coherent prevention policy, and collective protection measures and appropriate instructions to workers. So it covers pretty much everything in that, and that's what was used as the basis of, in the UK, Health and Safety Executive Guidance previously. So Article 7 of that legislation was about protective preventative services, and employers designated one or more workers to carry out these activities on behalf of workers for the establishment. And it talks about competent external services. And competency is a word that's used quite a bit in legislation in the EU and in the UK. That's why, as Richard mentioned, I'd been involved in the training, or Lynn mentioned, I've been involved in the training of over 1,000 physicians and nurses, because although we do health surveillance for hand-arm vibration, we had been concerned, in particular the health and safety executive had been concerned that it wasn't being done very well. So you can't expect any family physician that hasn't had specific training to examine somebody who you think might have hand-arm vibration syndrome and come to a correct conclusion, let alone give correct advice thereafter. And what was arranged was competency training. So a syllabus was come up with, and training was given for occupational health doctors and nurses, or doctors that would be involved in that, so that they would have a minimum of training in this area. Now, competency doesn't only apply to doctors and nurses, it applies to anybody that's involved with the health and safety process. So it's about hygienists, it's about health and safety officers, anybody providing services. They have to be professionally competent is what it's about. Health surveillance was also included. This is back in the 1989 criteria. So it says that workers should receive health surveillance appropriate to the risks, and that needed to be introduced into national law. Now that, again, it's not specific to vibration, but it can be included. It would encompass it. And the worker can receive it at regular intervals, and it gives the provision that it could be provided as part of a national health system. That isn't the way it's provided in the UK. It's more like the way it may be provided in France, for instance. But it's down to the individual state there in the EU to decide how it's provided. Something we didn't really touch on in any other discussions, I think, so far, is this provision, risk groups. So it recognises that some people may be particularly sensitive or vulnerable groups. So they may be more sensitive to a hazard, and there we would say there's a greater duty of care towards them, because they, more than the next person, may be at risk from being injured. So arguably, if you know somebody already has carpal tunnel syndrome, or maybe diabetes, which is associated with carpal tunnel syndrome and also associated with vascular effects and other problems, that maybe they are at higher risk from vibration exposure. Do we have the medical evidence to say so? No, I don't think we do. But that's sort of precautionary. Maybe that's advice you might give to an individual. Maybe it would be discriminatory to give it on to exclude somebody as part of a employment policy. But there may be people who might be more sensitive. So perhaps somebody who had already got degenerative disc disease that you knew was going to be exposed to some circumstance with whole body vibration where you knew there was a high risk. Again, you may want to give them particular advice. So the guidance that we previously had in the UK under the management regulations, the old 1989 guidance, HSE had produced this document in 1994, Vibration Solutions. And then when the new guidance came out, which was in June or July 2005, they produced a further guidance document, this HSE L140, which is a very good document. You can download it free from the HSE website, and it covers most of what we've talked about. In my own view, I think there's a whole chapter missing from it on ergonomics. It doesn't talk about ergonomics, but it talks a lot about vibration, it talks quite a bit about hand-arm vibration syndrome, and it talks a bit about whole body vibration. It doesn't cover the whole body aspects of it in as much detail. And again, that's maybe something to consider is guidance. We've talked here about amongst professionals what to do, but how would an employer know what to do about vibration? What guidance is there for them to pick up on maybe? This is an example, just because I don't want to talk all of the time. These are some people working in a forge. This is maybe a different sort of vibration exposure than we've talked about so far. So this is in Sheffield, forge there. What you have in a forge, you've got a four-man team here. He's imaginatively called the number one man. He's called the number two man. He's called the number three man. Do you know what he's called? It's just there. No, he's the hammer man. So, anyway, that's the team. And just watch what they're doing. And not only look out for the vibration, but have a look for some of the other hazards involved as well. Where's this? So that's red hot. So he's using a pair of tongs to turn that round. So the question there was around vibration exposure, and it's quite complicated to measure the vibration exposure from that because it's impact vibration that people are getting. This guy is holding something called a mandrel there that it's beaten against, and this guy's got a similar device on the other side, and this guy's with the tongs, he moves it round. And the guy at the back's the hammer man that pushes the lever that drops the hammer. So out of those four, show of hands, who do you think gets the most vibration exposure? Number one man, show of hands. He's the man with the tongs. Number two man. Yeah. Number three man. Hammer man. Okay, well, those who thought the hammer man is right, it was a surprise to us actually. We thought it was going to be the number one man with the tongs. But surprisingly, it was the hammer man that got the most vibration exposure as we'd measured it. And that's a 1-ton hammer. They had a 1.5-ton hammer and a 2-ton hammer in the place. So back to control of vibration at work regulations. So they introduced exposure action levels is the important thing about them. We've talked about them already. So for hand transmitted vibration, it's 2.5 meters per squared meter squared, and that's A8 weighted. And also the whole body vibration action level there of 0.5 meters per second squared. And those are called action levels because if people are exposed above those levels, then employers are required to take action. And then there's a limit value, and the limit value is a limit above which people are not allowed to be exposed. There was a lead-in time to that, which was 2010. So they were introduced in 2005, and workplaces had up to 2010 to comply with the limit value. But they had to comply with the other aspects of it before that. Limit values are there as well for hand-transmitted and whole-body vibration. So for hand-transmitted vibration, health surveillance is explicitly required. It isn't explicitly required for whole-body vibration. And what health surveillance is considered to be is that a program of systematic health checks to identify early signs and symptoms of disease to allow action to be taken to prevent its progression. Otherwise, there's not a lot of benefit doing it if you're not going to make a difference to somebody. But the important thing is that it's also useful in monitoring the effectiveness of the controls. Because if you're getting people in a workplace who are having new symptoms, then that's saying something about the exposures they're getting. They're sufficient to cause disease is what it's saying, so they're not good enough. And it requires employers to introduce suitable health surveillance for those employees who are at risk from exposure to hand-arm vibration. Perhaps also of interest, anonymized health surveillance results for groups of workers should help monitor how well your vibration risk control program is working. And it's actually a requirement of the regulations to produce those figures so that, because that should be used as feedback, so it should be discussed in a safety forum to say, well, look, you know, we still got cases occurring in this area. But it's anonymized, so, you know, if you've only got one person or two people in an area, then fine, you can't give it down at that level. But if you've got a large fettling shed or something like that, then it may be feasible. Estimates of the number of people exposed to vibration in the UK come from a study, it's a little old now, but just before 2000. There are about 5 million people expected to be exposed to hand-arm vibration at work in the UK. This was from a postal survey that was done. And about 1.6 million workers above the action level, and just around 1 million were expected to be being exposed above the limit value. There's a common approach in the vibration regulations as in other EU health and safety regulations, and there's duties. So there's duties to assess. So you've got to assess the risk. The starting point for assessing the risk would really be a walk-around survey. So you look at what you're doing. Things like, do you have a purchasing policy? Do you have a maintenance policy? You know, do you know what exposures people are getting? Have you made any estimate of those? And in the UK, as was already mentioned, and throughout the EU, because of the directive, if you buy a new tool, it has to come with the emission value, the vibration emission value on it. And if it doesn't, then the manufacturer certainly has to tell you what it is. There are some exceptions. So there's a thing called the Machinery Directive, and there's some exemptions there. And I found one when, in the hospital I worked in, we said, look, vibration regulations are in, to the managers. If you think you've got any staff exposed to vibration, let us know and we'll tell you if they might need health surveillance. And the plaster saws in the, did they count or not? I said, well, don't know, what's the vibration level? Tell me they might. And it said, well, it wasn't on the saw. And when you look, they're exempt under the Machinery Directive because they are intended as medical devices. Now, the intent there is that if you're getting your plaster off, you don't care what the vibration exposure is because you're having one plaster cast off, pretty much. But that's not within the spirit of the law, which is for the person who's using the plaster saw, it's slightly different. So there are things like that that are anomalies. You've already seen the HC exposure calculator, so I won't say any more, except it's pretty easy to use, and it's on the website there. So that's another way of assessing the method. And there's also a points method, and there's a chart that looks pretty much like that. And you can, again, look up the, if you've got the vibration emission, and you know the number of hours, it gives you a point score, and then that's an easy way of, you can tot up the number of points so that if you've got somebody using more than one tool, you can see, are they likely to be above the action value or above the limit value or not. So control. Now, control is an important word because that's what the regulations are called. So they're expecting employers to control vibration at work, and so that is a key word there. So this is about what employers are doing to prevent, reduce exposure to vibration. So that's what the inspectors go looking for when they're assessing workplaces, is not only have you assessed what the risks are, but what are you doing? What's your control plan to reduce those risks or avoid them? I did have a couple more slides on gloves, but I've removed them. That's generally the position in the UK, that they are available, but they're not promoted, not least because there's a bit of a concern if you promote them, then that's all employers will be inclined to do. Whereas, as has already been said, they're fairly low down the hierarchy of control. Another important bit is information, instruction and training, IIT, and that's again common across a lot of UK health and safety legislation. So like you say, you can have a fancy seat for riding on, but if you don't adjust it properly, it may be no use, or it may be worse than a non-hydraulically adjusted seat. And the same for training for use, for maintenance of tools, why it's important, people need to know. Also, the information, what you would regard under WMIS, that people need to know about the risks that they may be exposed to as well. So that would come under that as well. So health risks and symptoms, and correct tool use. It's a half serious point in that cartoon that you need to let the tool do the work for you, and because otherwise you get people pushing hard on drills and things, and they just get more vibration transmitted through their hands. Reporting arrangements, health surveillance, as I say, is a key thing in the EU registration. Risk reduction measures, what people can do for themselves, and the training in the use of the equipment. Monitoring. So one of the things about monitoring is health surveillance, and this is the tiered scheme that's recommended by HSE. So when people come in to take a job up, then there's pre-placement, not pre-employment, but pre-placement screening that's done. And then that's repeated at 1 year and thereafter at 3 yearly intervals. And it's only made 3 yearly for no good scientific reason, but really because the noise regulations already required 3 yearly audiometry, so this was done just to coincide with that. There's no science behind it that I'm aware of. And it includes for if somebody has symptoms, then them being referred to a doctor or nurse, and at level 4 for diagnosis, that means a doctor, and level 5 isn't mandatory, but if there's any doubt about the diagnosis or if it would help clarify it, referral at level 5 is around what's called standardized testing, the sort of thing that's done at St Michael's Hospital with vascular testing and neurological testing as well. Monitoring, so checking the control measures, so reassessing really, and also using the health surveillance to provide feedback about the adequacy of the controls. So this is what we're saying in summary, that there are these control of vibration at work regulations. Exposure and rest needs to be as low as reasonably practicable is the wording we use. And we should also have a program of health surveillance, and that's integral to the risk control. One final thing I'll say is ICD-11 is something also I'm involved in. I know Lynn's also involved. This is the International Classification of Diseases, and we're trying at least to get all those diseases that are in the ILO list mentioned in the International Classification of Diseases. There's a new edition coming out. It's there on the web in ICD-11 draft. You can look up ICD-11 beta draft, and you're invited to comment. One of the items, you can't read it there, but hand-arm vibration does actually appear due to the kindness of the dermatologist, because it appears within the dermatology category, which you might think isn't necessarily the best place for it, but WHO wouldn't let us put it anywhere, but the dermatologist snuck it in for us. So if you feel that it might be better represented elsewhere, you're free to give comment. And WHO encourage you to do so, and there's the website. But if you just put in ICD-11 beta draft, you can find it, and you can look it up in the search tool at the top. So that was a picture I took outside the medical school in St. John. There's a guy there using a still saw. You can see there's a car there in the background. There's the guy using the still saw. This is about a second later. There's still a guy there using a still saw. Okay. That's it. Thank you very much.